I'm Dr. Abhishek Mangeshikar, an endometriosis surgeon. And today we're addressing a topic that affects so many but is often misunderstood. Period pain. How often have you been told it's just normal period pain or you just have to deal with it, it's part of being a woman? These statements might sound familiar to many, but they can also prevent you from getting the care you need. In this video, we'll debunk common myths about period pain, explore what might be causing severe cramps, and help you understand when your pain might be signaling something more serious. Let's dive in. Let's start with the myth that all period pain is normal. It is true that mild cramps are a common part of menstruation. The uterus contracts to shed its lining and that process can cause some discomfort. But here's where the myth gets dangerous. Society has normalized severe period pain to the point that many people believe it's just something they have to live with. The result? Countless people are left undiagnosed and untreated for conditions like endometriosis, adenomyosis, or fibroids, sometimes for many years. The reality is, severe or disruptive period pain isn't normal, and it's your body's way of telling you that something might be wrong. What's normal versus what's not. So how can you tell the difference between normal period pain and pain that might indicate a deeper issue? Normal period pain might just have mild to moderate cramps, which lasts 1 to 2 days and improves with over-the-counter painkillers, which doesn't require an inordinate amount of painkillers. It does not interfere significantly with daily activities. Pain that's not normal feels sharp, stabbing, or burning. It begins a couple of days before the period starts and continues after it ends, but this can vary. It is so severe that it disrupts work, school, or social activities. It does not improve with standard pain relievers like ibuprofen and may require higher doses to achieve some semblance of pain relief. If your pain falls into the second category, it's time to pay closer attention. Severe cramps that can be a sign of underlying medical conditions. Let's explore some of the most common ones. Endometriosis is when tissue resembling the lining of the uterus grows outside the uterus, causing scar tissue, fibrosis, inflammation, and pain. Symptoms include chronic pelvic pain, painful bowel movements or urination, pain during sex, and infertility in some cases. Adenomyosis occurs when the uterine lining grows into the muscular wall of the uterus, causing global enlargement of the uterus. Symptoms include heavy prolonged periods, large blood clots, and an enlarged tender uterus, also lower back pain and midline centralized pain. Fibroids are non-cancerous growths in the uterus that can cause severe cramps. Heavy bleeding, pelvic pressure, or back pain might be some of the symptoms. Pelvic inflammatory disease is a rare condition but is an infection of the reproductive organs. Symptoms can be intense pain, fever, and unusual discharge. Ovarian cysts are simply fluid-filled sacs in the ovaries that may rupture, causing pain. They may also undergo torsion, which is a twist in the ovary that is a medical emergency and require immediate intervention. Pelvic congestion syndrome. These are enlarged veins in the pelvis similar to varicose veins, which can lead to chronic pain. It's a dull, aching pain that worsens after standing for long periods or during intercourse. Vascular and nerve entrapments. Conditions like vascular entrapment syndrome or nerve entrapments can mimic pelvic pain depending which nerves are affected. Symptoms include burning, tingling, or radiating pain that doesn't improve with traditional treatments. Musculoskeletal disorders like fibromyalgia and rheumatoid arthritis can cause widespread pain, including in the pelvic region. Symptoms may be painful, often accompanied by fatigue and other systemic symptoms. Each of these conditions requires a different approach to diagnosis and treatment, so recognizing the signs is crucial. If you're experiencing any of the following, it's time to consult a doctor. Pain that's so severe it disrupts your daily life. Pain accompanied by heavy bleeding, irregular periods, or gastrointestinal symptoms. Pain that progressively worsens over time. Pain during specific activities like sex, urination, or bowel movements. Keep a symptom journal. Note the intensity of your pain, when it occurs, what makes it better, what makes it worse, and any other symptoms you may experience. This can help your doctor identify patterns and make an accurate diagnosis. Advocating for yourself is critical, especially if you feel your concerns are being dismissed. Here's how to do it effectively. Be specific about your symptoms. Instead of saying, I have bad cramps, try, I experience sharp pelvic pain during my period that lasts for 3 days and doesn't improve with medication. Ask the right questions. Could my symptoms be caused by a condition like endometriosis or adenomyosis? What diagnostic test would you recommend? Seek a second opinion if necessary. If your concerns aren't taken seriously, don't hesitate to consult another doctor. You know your body better than anyone else, and if an experienced physician will know that the patient's history will give you more insights than any imaging tests. Common myths about period pain. Let's debunk a few more myths that might be holding you back. If you've had children, your period pain will go away. While childbirth can provide relief for some because there is a temporary cessation of menstruation, there is no regression of the disease and it is not a solution for treating endometriosis. Severe cramps mean you're infertile. While conditions like endometriosis can affect fertility in up to 30 to 40% of patients, pain alone isn't an indicator of infertility. Many people with painful periods and endometriosis go on to have healthy, successful pregnancies. Hormonal birth control is the only way to treat period pain. Birth control or progesterone-only pills or GnRH analogs are all suppressive medications that suppress the hormones. This will temporarily dull the symptoms. This is not a treatment of the disease, rather it's a treatment of the symptoms. Eventually, as of right now, the only treatment modality is to surgically excise the disease, and surgery should be chosen for specific candidates depending on examining the patient. Period pain isn't something you should have to tough out or live with. Severe pain is your body's way of telling you that something might be wrong, and it deserves attention. If your pain feels unmanageable, seek help. There are effective treatments available, and no one should have to suffer in silence. Thank you for watching. I hope this video has helped you understand the difference between normal and abnormal period pain and why it's so important to listen to your body. If you found this helpful, please like, share and subscribe for more educational content. And if you've had experiences with severe period pain, share them in the comments below and you could help someone else. Thank you, and I'll see you in the next video.